Today we're going to go over the anatomy of your what we call a golfer's elbow. Golfer's elbow, just to make a distinction, is on the inside of your elbow, and tennis elbow is on the outside of the elbow. But what they're really denoting is it's an inflammation of the tendon. So let's turn on all the muscles in the arm. So these are all the muscles in the arm. We're going to zoom in on the flexor side. So this is the flexor side. If you look at it, it attaches all the way from the inside of your bone here all the way down into your hands. There are several muscles that comprise your flexors into your hand. But if we're going to zoom in, you're going to see that there is an epicondylitis here. So we're actually going to take this out, hide that. You're going to see that there's a bunch of things that attach right into your what we call medial epicondyle. And you'll see the white denotes tendon, and then your muscle denotes the red. Sometimes the tendon comes a little bit longer, sometimes the muscle comes up into the tendon a little bit deeper. But in this case, I would say when you look into anatomical labs and dissections, the tendon actually is much longer, and then the muscle is mostly starts from here. The strongest points of this muscle is actually going to be at the junction of where the tendon turns into muscle. And in these anatomical apps, it doesn't represent this strict delineation between your bone and your tendon. What ends up happening is if you go into the microscopic level here, sometimes what happens is bone slowly turns into tendon, and tendon slowly turns into bone, and there's kind of this mixture, this in-between place. It's not as black and white thing where it becomes bone and then tendon. And the same thing happens over here. You see it's slightly muscle in here, but also tendon here. When we have a tendinitis, an itis means that there's an inflammation in the bone. Oftentimes what happens is this area of junction where it turns to muscle and tendon, this area is the area that gets really inflamed. And there's going to be some micro tears in this region that create inflammation, which creates the pain. Oftentimes symptoms are handshaking or any type of making a fist with your hands. Those are the things, or what we call wrist flexion, meaning your fingernails are going towards your elbow. These are things that will lengthen the tissue in here and create inflammation in this region. So this is a quick explanation of what a golfer's elbow is.